Hello nurses and future nurses, welcome back to my YouTube channel. And on today's episode of Nurse Clement B, I am going to teach you on how to give oral care to oral care. Remember, this is not oral care for an unconscious patient. You are going to assist the patient. I remember, was it last year or last 2 years, Nursing Council set an examination on oral care. Assist this patient to carry out oral care. Do not confuse yourself with unconscious patient. This is a conscious patient. It's just that you as the nurse, you are assisting this patient to carry out oral care, of course, right? So now sit back and watch this video till the end. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. And in case you want me to do any procedure, just drop it at the comment section. Please like, share and subscribe. Encourage your colleagues and other students, nurses, and other people that are interested in studying nursing to watch this video. Thank you for your love. Thank you for your share. So the best thing for you to do now is for you to set your requirements. And I have my jar with water, cup, my toothpaste, my mouthwash, and a receiver, right? And my bowl, right? So the next thing is for you to identify the patient. Identify this patient. Is this the right patient? Of course, in nursing, it is important that you identify the right patient. Make sure that you perform any procedure you want to perform. Make sure you perform it on the right patient. And to achieve that, you have to identify this patient. Ask the patient to mention his or her name, her official name, and then cross-check on the folder on the system whether this patient is the right patient, right? So I'm going to introduce myself. Please avoid saying that during examination. Just go ahead and introduce yourself. Do you understand? Right. So, good morning. My name is Nurse Clement, and I'm here to assist you to take care of your mouth, right? To perform oral care. So, I'm here to do that. Is that okay? And I'm going to give you toothpaste with your toothbrush and water. Then you brush your mouth, right? Is that okay? Can I go ahead? So now the patient, I have introduced myself to the patient and I explained the procedure to the patient. Now I want to ask the patient her full name and date of birth. So can you please tell me your full name and your date of birth? So your name is Chukwuemeka Eze and your date of birth is 1st January 1999, right? So I have identified my patient and I have cross-checked with what I have on my record, right? And this is the right patient. So now you help me to sit down so that I can bring the things that you need for the oral care. So as for me, the nurse, I'm going to perform hand hygiene out now with my glove. So follow me, let's go and perform hand hygiene. So I'm done performing hand hygiene and I'm done my glove, right? So during examination, don't say that I will perform hand hygiene. Just go ahead, perform hand hygiene and come and don your gloves, right? So I'm done doing that and I will fetch water, pour water inside my cup. This is my toothbrush and I apply the toothpaste on the toothbrush, right? So, and the next thing is for me to apply this towel on my patient neck and I ask the patient to sit down, right? And I assist the patient to sit down to perform this oral care. Remember, we are assisting this patient to perform oral care, right? So maybe the patient's arm may be amputated or have burns or anything can happen to the patient depending on the condition of the patient. And you have to assist this patient to perform this oral care. So I am done. We're applying toothpaste. I'll put my bowl around, then bring water and dip the toothbrush inside. And so you assist the patient, right? You assist the patient to perform the oral care. As you can see, you start from inside, you turn the toothbrush, right? You up, down, right? Assist the patient, ask the patient to close his or her teeth. Remember, this is dummy, right? Remember, this is dummy, so we may not achieve what we want. And then you brush the patient's teeth from inside. Then ask the patient to bring his or her tongue out. Then you brush the tongue this way. You brush the tongue and ask the patient to spit inside this bowl, right? And then give the patient water to rinse his or her mouth, right? After when the patient is done, you discard use equipment. You are done. You ask the patient, right, to rinse his or her mouth, give the patient water, then you dip this inside water that is beside you, and then clean the patient's mouth with a different flannel, right? If possible, you clean the patient's face too, right? You clean the patient's face, right? After which, then you give the patient a little lip care. Then you apply Vaseline, or if the patient have any lip balm, you apply lip care so that the patient's lip will not crack. So for this procedure, I'm using jelly Vaseline. Now that I'm done and I'm going to make my patient comfortable, right? And I place the patient back to the normal position and I cover the patient's body, right? So, and do not forget during exam, during OSCE, right? Tell your examiner that I am discarding used equipment by rearranging them because this is OSCE, because another candidate is coming right after you. So please do not scatter the equipment. As you can see, the next candidate, if the next candidate arrive, you will not be confused, of course, because I have arranged everything, right? So the next step is for me now to remove this glove and go and perform hand hygiene. So follow me, let's go. I'm done performing hand hygiene. So the next thing is for me to record the procedure that I have performed on this patient. Oral care performed at so time, right? 10 a.m. and the patient did not bleed well performing the oral care. The patient's gums were not sensitive. Were no rashes because I have observed the mouth of the patient while performing the oral care. So thank you for watching this video. Thank you for staying with me till the end of this video. I remain Nurse Clement B. Do not forget to like, share and subscribe to my YouTube channel at Nurse Clement B. And in case you are finding it difficult to perform any procedure, please do not hesitate. Chat me up or drop a mail at nurseclementb@gmail.com and I'll be right there to help you. Thank you for watching. Bye-bye.